There are a multitude of reasons why patients are firing their doctors. 1, poor communication. 2, long wait times. 3, lack of trust or chemistry. 4, the doctor or staff seem rushed or unavailable. And 5, poor coordination of care. These have come up consistently in patient surveys and studies. And if you're dealing with any of these, well, it's worth looking for someone new who fits better. Today, we're with Russ Scala of Scala Precision Health, and we're going to talk all about patients who fire their doctors and what you should be looking at, right?
Right, exactly.
Amazing.
Yeah, it's interesting. People are educated now, and people are asking tough questions. They're forming communities using social media, and you know, when you have 4,000 people, say, with diabetes that are doing their own research, and then they go into their doctor and they start asking questions of things they learned, a lot of times the doctor gets offended and he says, you know, your Google search is not going to equal my medical degree, so I act as a patient advocate for the patients.
Yeah.
We got 155 medical schools in this country, and none of the doctors study diet or nutrition. So this patient that has a disease, that did the research, they're coming into the doctor's office educated, but the doctors are handcuffed by the insurance companies, and they only get 7 to 10 minutes with each patient. How are you going to really care for somebody in 7 to 10 minutes? So people are firing their doctors, and they're calling us to build a therapeutic relationship with physicians that we know that will take care of them. Okay, there isn't any doctor on the planet right now that's going to take care of all these areas. So from a wellness and a longevity standpoint, looking at environmental toxins, hormonal deficiencies, the mitochondria on a cellular level, how you create energy, the ketogenic diet, the microbiome, nutritional deficiencies, that's what a patient needs, and that's what we're helping patients understand. So instead of going to 4 different doctors, they're able to go to 1. Or they're able to call us and we're able to get them on track with this, just to cut to the chase.
And just to give a little of context for your expertise, I would say, in this field, you've been working for 30 years training physicians and training patients. Would you say that you've seen this get worse over time? Are we in a place where patients are advocating more so for themselves, or?
Most people don't want to, in their 60s, they don't want to go to 3 physician visits a week. Diabetes and heart disease and dementia all have 3 different doctors, but really it's just one disease. So they could, if they understand that and they take our research and we help build a therapeutic relationship with the patient and the doctor, we'll be able to get more of this accomplished in a very short period of time. A lot of patients go on a 5-year journey and they're very frustrated, but their research they collected on their own illness over 5 years will surpass anything a doctor knows. Like I said, 155 medical schools, they don't teach nutrition, they don't teach diet, they don't teach hormonal replacement therapy. So this patient that's actively involved in their own wellness and has tried certain things and done their own research, they know what they want, we help them with that.
And there's a term, Google doctor, for patients who, like the ones you're describing, who are doing all this research for themselves. Now, in the medical field, that would be derogatory, right? They don't enjoy those patients that come in thinking they have all this information. What would you say? Could you, first of all, explain what Google doctor is?
Well, like I said, I train physicians for a living, and I have for 20 years. And they do say, well, these patients come in and they're going on Google. Well, whether they're going on Google, Chat, or Grok, they're coming in educated.
That's right.
So you're going to have to step your game up. Patients are coming to a doctor and say, Doc, why are you giving me medications when you could look at my hormonal deficiencies? Doc, why are you giving me a handful of medications when you could look at nutritional deficiencies? And hey, Doc, you're not what you eat, you already absorb. How come you're not checking my microbiome, which is considered the second brain? Come on, work with me here. You can't pick everything up on me in 10 minutes. I've been living with this disease. Yeah. And if the doctor doesn't play ball, if he doesn't want to order the lab work, tell him to document it in your chart, and then with respect, find another physician or call us and we'll help you.
You'll help them advocate for their health.
Yeah, exactly. We'll do an intake and tell them the blood work they need at no cost.
Nice. Well, I know more patients need to be taking control of their health, but sometimes it's just easier said than done when you have your doctor there telling you, hey, this is what needs to happen. This is the meds you need to take. This is the diagnosis that we've determined you have, and then sometimes they make you feel crazy, right?
Exactly.
For trying to go against.
Well, like I said, physicians training, 155 medical schools, doesn't train any physician in diet or nutritional supplementation. So we know that that's a fact. So the patients end up on their own on a 5-year journey, going to their nutritionalist, their doctor, the expert in endocrinology, and they're trying to get themselves better. And along the way, they're picking up these little gems of information. So instead of taking 5 years, they call us and we get it down to 30 days.
Yeah.
And we really push them in the right direction with real science. Like I said, if you got 10 minutes with somebody, or you're shooting down them asking questions, does that doctor really have your best interest at heart? Right?
Right. And you mentioned Google and ChatGPT and Grok, but interestingly, social media also plays a role in how patients are beginning to take control of their health. Would you agree with that? How have you seen social media kind of work in this space?
Well, there's a lot of social media. There's social media where there's 20,000 people on one social media page where they're sharing information on the ketogenic diet and diabetes. And we know the ketogenic diet turns around diabetes. Okay, we know how to keep your blood sugar down and keeping insulin levels low. So they're actually saving lives, and I'm watching people come off their insulin while they're on this page and never talking to a doctor. Fascinating, right?
Wow.
So when you have 10,000 people all investigating on their own and coming together under one roof and sharing information, some of the information a little sketchy, okay, but at least they're all on the same page. And what I say is everybody's biochemically unique.
Right.
So we have to look at all of these areas. We train somebody to look at all of these areas instead of just focusing on medication. If we're going to give a diabetic his insulin, there's so much more that could be done, right?
Right. I want to talk about a particularly scary statistic, actually. The third leading cause of death in the U.S. is...
is our own medical system.
Our own medical system.
And I know a lot of malpractice attorneys. And exactly right, a lot of mistakes are made. And it's the third leading cause of death in the United States. So if that doesn't send a message to you, and the average person gets 10 or 15, just 8 to 10 minutes with their doctor, how are you going to get anything done in 8 to 10 minutes? So the people are saying, I want to do my own research. I'm going to change my diet. I'm going to hire a patient advocate. They hire Scala Precision Health to really drill down on the blood work. And we send them the blood work at no cost. Just get these labs done.
How long do you spend with your patients?
When I get a call and we set up a call, I tell them to take out a pen and pencil or a pen and to take notes. And I listen to their story for 2 hours.
Wow.
Average. I want to hear about what happened to them as a kid. Were they a war veteran? Did they go through a divorce? Because everything in the environment affects their health, right?
Versus the 8 to 10 minutes in our standard medical facilities, huh?
Yeah, well, let me give you an example. When I wanted to stop drinking, I was attached to the SWAT team as a paramedic. I became a triathlete in the early 80s, and I was hanging around probably 50 endurance athletes. We would swim together, eat lunch together, ride our bikes hundreds of miles. That whole community saved my life. Okay, so, and then when I started looking at athletes having heart attacks, I would take these athletes into doctors' offices with the research way back in the early 90s and say, this is what's going on. And the first thing a doctor would say to me was, did you go to medical school? I go, me going to medical school doesn't matter. I live, eat, and sleep and race with these triathletes. Yeah. You have no idea what their metabolism is going through. I put the research there for you. Now you're intimidated and asking me if I go to medical school. We'll see you later.
Absolutely.
Right?
Yeah. So is Scala Precision Health just for those who are going through an illness or they're looking for answers to a health concern, or could the healthy individual also benefit from reaching out? Who is Scala Precision Health for?
Yeah, I focus on athletes a lot, the athletes over 40, because doctors don't know what to do for athletes over 40. And I get clients that want to climb K2 at 50 years old. I get clients that said, Russ, I want to run a marathon. And I'm like, okay. And I help them because training for a marathon at 50, if it's not done the right way, you're going to really beat your body up. But there's ways to do it safely. So I get a lot of people that they get on our hormonal replacement program and they feel so good, they want another challenge. And sometimes life starts over for our clients. You know, they want, instead of being in the gray zone and getting up out of bed and like looking through the lens of nothing's going to change, all of a sudden when they start feeling good, they want to take on a challenge. I love working with people like that. Yeah. So we have a performance and a longevity program. You know, it's not just for people with diagnoses of illnesses.
Ultimately, you're here to help anyone who's maybe fed up with their doctor,
Yeah.
right? Fed up with being ignored, fed up with not having their concerns heard.
Yeah, I've been in medicine over 40 years and made a lot of mistakes, but I do surround myself with the best and the brightest in the country.
Russ, thank you so much for being with us, for sharing all this information, and we want to make sure our audience at home also knows how to reach out to dig in deeper and get their own help with their medical needs. So for those of you at home, if you would like more information on Russ and Scala Precision Health, you can visit scalaprecisionhealth.com. And if you're ready to dive in even deeper, you could also visit the Scala Precision Health YouTube channel, which is packed with free knowledge and insights you can start using today. You can also find his book, American Biohacker, available now on Amazon. Thank you so much for watching. We'll see you next time.